So PTSD, or post-traumatic stress disorder, is a serious and often debilitating illness that can affect the individuals who have either been exposed or witnessed a traumatic event. And the traumatic event can vary in a person's life, and these include natural disasters, so these could be hurricanes, earthquakes, or a violent event such as a rape, sexual assault, murder, physical assault, or even an untimely or sudden death of a loved one. So it's very important to note that not everyone who is exposed to a traumatic event or a stressful event in their life will go on to develop a full symptom or diagnosis of PTSD. Actually, it's believed that about 70% of the US adults have experienced what's classified as a trauma or a traumatic event in their life. Yet only about 20% go on to develop symptoms of PTSD. So PTSD, as the name suggests, is post-traumatic stress disorder, which literally translates mean a disorder that develops because of stress after exposure to a trauma. And the way I always tell my patients is that when you look at the PTSD, there are many different types of symptoms that can develop that together come up with a diagnosis of PTSD. So number one, a patient or an individual must have had an exposure to a traumatic event, like we talked about before. Number two, they must develop within a month of the trauma symptoms that are called intrusive or interruptive symptoms. And these generally are, for example, nightmares, flashbacks relating to that particular trauma, or even really distressing memories of the traumatic event. Second, can be avoiding symptoms. So these are those individuals who have had a trauma in their life and now would avoid any particular thing that will remind them of the trauma. So for example, if someone watched an accident on a highway, they will make every effort in the book to avoid taking a car or going on a highway because it caused tremendous amount of an emotional distress. Three, these are the patients who can always develop a lot of mood symptoms. So these are symptoms such as being depressed, isolated, even not remembering the parts of the trauma that happened to them. And four is what they call reactive symptoms, which is that these particular individuals exposed to trauma will become very reactive in their body and in their brains. So these are the patients who will become angry, irritable. They will often startle very quickly by the things that are generally normal around them. So when you take the cluster of these symptoms together, exposure to trauma, recurrent memories or flashbacks, avoiding the situation that causes distress, mood symptoms, and irritability, anger, and easy startle, when you combine them together, they account for all the symptoms of PTSD. So PTSD in some cases can be a lifelong illness. However, if identified early and if treated early, the course of illness can be much better over time. Many patients can have symptoms of PTSD in lifetime. However, the intensity of the symptom do tend to get better with treatment over time. PTSD can and many times does increase the risk of having other mental problems as well. For example, about 30 to 50% of the patients that suffer from PTSD are also diagnosed with depression. And about 40 to 50% of patients with PTSD are often diagnosed with substance abuse, alcohol disorders, or drug opiate addiction disorders as well. So research is actually a very important tool for many of our patients that are suffering from PTSD. Many of my patients who come to us to enroll in a particular research study often will cite two important things in their minds. Number one, ability to individually understand their illness better, and number two, to be able to help others in the community. So for example, research often offers substantially more time to these patients and individuals suffering from PTSD to help them better understand their illness. And second, it also provides what I consider a holistic care in which the medical, social, and also psychological factors are taken into account when doing an evaluation for a research study.